Welcome to UMCC Medical Consultants Connector, where your health matters to us. The world has recently been grappling with the emergence of a new virus known as human metapneumovirus, or HMPV for short. This virus, first identified in 2001, is a type of respiratory virus belonging to the family, which also includes the respiratory syncytial virus, or RSV. While HMPV has been around for a while, it has recently caused a surge in cases, particularly in China, raising concerns about its potential impact on global health. HMPV spreads through respiratory droplets released when an infected person coughs or sneezes. These droplets can land in the mouths or noses of nearby individuals, leading to infection. In addition to direct contact, HMPV can also spread through indirect contact with contaminated surfaces. For example, if an infected person touches a doorknob and then a healthy person touches the same doorknob, the virus can be transmitted. The recent outbreak in China, particularly in Beijing, has been attributed to several factors, including the virus's seasonality. Like many respiratory viruses, HMPV tends to thrive during the winter months, when people spend more time indoors, increasing the chances of close contact and transmission. Furthermore, the co-circulation of other respiratory viruses such as influenza A, mycoplasma pneumonia, and COVID-19 has complicated the situation in China. The presence of multiple viruses simultaneously can overwhelm healthcare systems and make it challenging to control the spread of infection. Identifying the symptoms of HMPV is crucial for early diagnosis and management of the infection. The virus typically has an incubation period of 3 to 6 days, during which an infected person may not show any symptoms, but can still transmit the virus to others. Once symptoms do appear, they often resemble those of the common cold or flu. The most common symptoms of HMPV include cough, fever, nasal congestion, and shortness of breath. These symptoms are usually mild and resolve independently within a week or two. However, in some cases, HMPV can lead to more severe complications, particularly in young children, older adults, and individuals with weakened immune systems. In young children, HMPV can cause wheezing, breathlessness, and croup, a condition characterized by a barking cough and difficulty breathing. In older adults and immunocompromised individuals, the virus can lead to bronchitis, pneumonia, and worsen existing respiratory conditions such as asthma and COPD. Ear infections, also known as otitis media, are also a possible complication, particularly in children. It is important to note that the symptoms of HMPV can vary from person to person, and not everyone infected with the virus will experience all of the symptoms. Furthermore, the severity of symptoms can also vary, with some individuals experiencing only mild symptoms, while others develop more severe illness. If you suspect you or your loved one might have HMPV, it is essential to seek prompt medical attention. Diagnosis of HMPV is primarily based on a clinical evaluation, where the doctor will ask about your symptoms and medical history. They will also perform a physical examination, listening to your lungs and checking for other signs of respiratory infection. While clinical evaluation is often sufficient for diagnosis, laboratory tests can confirm the presence of HMPV, especially in severe cases. Polymerase chain reaction, or PCR testing, a highly sensitive and specific molecular test, can detect the virus's genetic material in respiratory samples. Unfortunately, there is no specific antiviral treatment available for HMPV, therefore treatment primarily focuses on providing supportive care to alleviate symptoms and prevent complications. Over-the-counter pain relievers and fever reducers, such as acetaminophen or ibuprofen, can help manage fever and discomfort. Adequate fluid intake is crucial to prevent dehydration, especially in individuals experiencing fever or sweating. Rest is also essential for the body to recover and fight off the infection. In some cases, doctors may prescribe bronchodilators to open up the airways and relieve wheezing. Preventing the spread of HMPV is paramount in controlling outbreaks and protecting vulnerable populations. While there is currently no vaccine available for HMPV, several effective preventive measures can significantly reduce the risk of infection. Good hand hygiene is one of the most effective ways to prevent the spread of respiratory viruses, including HMPV. Washing your hands frequently with soap and water for at least 20 seconds, especially after coughing or sneezing, before eating, and after using the toilet, can help remove the virus from your hands. Covering your coughs and sneezes with a tissue or your elbow helps prevent the spread of respiratory droplets that may contain the virus. Avoid touching your face, especially your eyes, nose, and mouth, as this can introduce the virus into your body. Wearing a mask in crowded or poorly ventilated spaces can also reduce the risk of transmission, especially for individuals at higher risk of severe illness. Social distancing, maintaining a distance of at least 6 feet from others, is another effective strategy, particularly for vulnerable individuals. Getting vaccinated against other respiratory illnesses such as influenza, COVID-19, and RSV can help reduce the risk of co-infection, which can be particularly dangerous. Staying home when sick is crucial to prevent spreading the virus to others. UMCC, your ultimate medical consultant connector.